And then I'm going to get my client's chart, so it's a little bit different, but I would always wash my hands first. I'm going to get my client's chart, and I'm looking in this chart for what was the patient brought in here for, what is their past medical history, what are they having done right now, what are we checking for, and what are her previous vital signs, and what's the previous cardiovascular assessment. All right? This is Mary Smith, by the way. I'm going to knock on the door. Come in. I've gathered my equipment. It's with me, so I bring it in and put it right here. Hello. Hello. Good morning. Good morning. I am Mary Dingo. I'm a nursing instructor from Bainbridge College. Well, hey, Mary Dingo. I'm Mary Smith. Mary Smith, it's so nice to meet you. Nice to meet you. I'm here today to do a cardiovascular assessment and talk to you a little bit about your cardiovascular history. Okay. I'm going to just use a little bit of hand sanitizer on my hand. And then what I'd like to do is just to identify you. So if you could give me your full name, Mary Joy Smith, and your date of birth.
8/12/71. I know I don't look a day over 20.
Now, I'd like to just have a seat at the bedside, and I'm going to talk to her about what brought you into the hospital, Mary.
Well, I was having some racing of my heart. It just felt like it was going really fast, and it would make me get short of breath.
Okay, now how long was that going on before you came into the hospital?
It was off and on for a couple of weeks.
All right. Did you have, besides the shortness of breath, did you ever get nauseated or feel like you were going to pass out?
Yeah, sometimes I felt like I was going to pass out.
Okay. Did you have any, sweat, body sweat when this happened?
No.
Did you feel like you had palpitations in your chest?
Yeah, like it was just pounding real hard.
Okay. How long would these episodes last?
Usually 2 to 3 minutes.
Okay, and what would make them go away? Did you do anything in particular to?
Well, I would try to sit down and do some deep breathing exercises, relaxation. I've been really stressed out.
Oh, have you?
I have a new class of 55 nursing students.
Oh, yeah. I can certainly understand that. Could you tell me, do you have any history of heart disease in your family? Your mother, your father, your sisters, your brothers?
My dad, he's had open heart, and then that was in 1990, and since then he's had stents placed on several different occasions.
Okay. Now, how old was he in 1990 when all this started?
Let's see, he was about 55.
Okay, all right. And so the doctor brought you in, and you're having some tests done right now. Have you had any testing while you've been in here? I feel like your heart's racing while you've been in here. All right. What I would first like to do is I'm going to palpate your carotid artery. So I'm going to put my fingers on your neck. Okay. All right. And what I would like to do is listen to your artery.
I pulled the curtain.
I did when I came in.
Oh, you did?
Yeah. I know. It's kind of invisible, so you can't.
That new technology.
All right. When I listen to your carotid artery, I'm going to ask you to exhale and just hold your breath just a little bit, and I'll tell you when to breathe. 1 second. Okay, go ahead. Take a breath, exhale, and hold your breath. And you can breathe. Great. Now I'm going to feel the other side of your neck. And we're going to do the same thing on this side. Listen first. Okay, take a breath, exhale, and just hold your breath for a few seconds. Okay, take a breath. Very good. Where am I going next? Now, what I'm going to do is I'm going to test for jugular venous distension. And I need some good lighting to look at her neck, so I'm going to ask her, fine. I just want you to hold your neck in a normal position. She's got a 45-degree bed height, which is semi-Fowler's position. And I'm just assessing if there's any distension in the external or internal jugular, and I do not see any at all. Sorry. Now, what I would do is I would provide privacy for my client, and I'm going to inspect her precordium, which you guys are not actually going to do, and that's what you're going to verbalize this. So I would want to visualize to see if I see any abnormal pulsations in the anterior chest wall, and then I'm going to palpate in all precordial areas for any abnormal thrills, lifts, or heaves. Okay? Okay. You're just going to verbalize it. Now, I'm going to listen to your heart and to several areas on your chest wall. And I'm going to first listen with the diaphragm side, and I'm going to listen to I'm going to just feel here, second intercostal space, right sternal border for the aortic heart sound. I'm going to listen to the pulmonic, which is directly over second intercostal space, left sternal border. I'm going to listen to tricuspid with it, which is fifth intercostal space, fourth to fifth intercostal space, left sternal border. And then I would go further down and listen to the fifth intercostal space, mid-clavicular line for the mitral valve. Then you're going to turn it to the bell side and repeat that sequence, okay, which is a Z area. I would also want to listen for 1 full minute, mitral valve, checking the rate and the rhythm of the pulse. And while I'm checking the mitral area, the apical impulse, I'm going to feel a radial pulse and make sure that I have a radial pulse with each apical pulse. I'm getting hot. All right. All right. On your assessment sheet, it says that you're going to have the patient in supine, semi-Fowler's, and left lateral, but really just having them in semi-Fowler's is going to be fine. We talked about pulse depth. Then I'm going to assess all of her extremities for skin color, for tone, for turgor. I'm going to check capryso in each of her extremities. Holding down for 5 seconds, release. I'm going to check pulses, including brachial, radial, bilaterally, both sides, and then you can verbalize that you're going to check femorals. And then I do want you guys to check the dorsalis pedis. You have a very good dorsalis pedis. It's graded at 2, and the posterior tibial, and it's also at 2. And check it bilaterally, both sides, and check capryso on your toes on each side. Of course, if they're painted pink, then I'm not really going to be able to check that.